64 Friday afternoon, mid-70s Saturday afternoon. Dry for Halloween and the Chiefs game on Sunday, and maybe some showers here Monday. We'll take another look at the forecast coming up in the next half hour. Curtis?
All right, thanks, Brett. October is National Health Literacy Month. The U.S. Department of Health and Human Services released an action plan to improve health literacy. Health Literacy Missouri is one group leading this cause, and the group's president and CEO, Dr. Arthur Colbert, is here to explain how the government's action plan can play a major role in health care reform. And welcome to the show, Doctor. We appreciate it.
Hey, thanks. Thanks for having me.
I was stunned by your group's information looking at it. It said 90 million people, 90 million folks, that's the same number who watched the Super Bowl, have trouble understanding and using health information. That is incredible. What's going on here?
Something as simple as reading a prescription label, filling out forms, making follow-up appointments. There's a major disconnect. The average American reads at the 8th or 9th grade level. Most health information is written at 12th grade or beyond. 1 out of 5 people in this country read at a 5th grade level. 2 out of 5 seniors read at a 5th or 6th grade level. So you can understand and see, particularly with the number of older adults and seniors who use the healthcare system, they just plain don't understand. And we as a society need to put that in perspective and begin to address that.
So should doctors, should hospitals, should healthcare providers dumb down the information?
No, dumb down is not it. We should be paying way more attention to more of a patient-centered approach and pay attention to who is this individual and how do we communicate in a way that's effective. So a hospital could just change its signage. If you've been in a hospital recently, good luck trying to get to radiology. A man told me the other day he was given instructions to go to radiology and didn't know what that meant.
Wow.
You know, he thought X-ray, but radiology, he left.
So X-ray?
Yeah, never had the X-ray taken.
Wow. Wow. Are there particular groups that have like the lowest health literacy and more likely maybe to be hospitalized because they can't read the prescriptions or even possibly death?
Again, I mean, the disparities, you know, the underserved, you know, people from minority groups a little bit higher, and particularly seniors, I think, is where one needs to focus his or her attention, as well as new moms, you know, those that English as a second language. So these are big groups that we need to pay attention to and begin to communicate at a level that people can understand.
Have you guys noticed the lack of understanding health information leading to people going to the hospital because they're taking the wrong meds?
Sure. I mean, in recent studies, you know, the first thing people do if they feel like they're sick and they really don't know what to do is they go to the emergency room or they go to a doctor. And what people have been doing actually here, in credit to Kansas City, in Kansas, they're giving out a book written at a 3rd grade level with a thermometer. So child is sick. The mom, instead of rushing off to the emergency room, takes the temperature, refers to the book. Temperature goes away overnight. Child goes to school. Mom goes to work. A simple thing that occurs tens of thousands of times a day can save tremendous amounts of money.
And how does Missouri rank when it comes to health literacy?
In terms of our health indicators, we're in the bottom quartile for sure. I mean, a recent study came out, I think, last week where we're last or next to last in terms of immunizations. We're way up there on obesity, smoking, all the big diabetes, all the huge indicators. So again, what Health Literacy Missouri is trying to do is to create information that people can understand, because we believe that people want to take good care of themselves, but they don't know how to. So if given the opportunity and given the information and you empower people, people have a much better chance of making good health decisions in everyday life. They're going to increase and improve their health behaviors.
Let's hope. Alrighty, Doctor, thank you so much. And what a cause. If you want to get more information, you can go to healthliteracymissouri.org. Once again, healthliteracymissouri.org. And thanks again. You need to check out that website. I mean, a lot of good information. We appreciate it.
Thanks for having us.
Alrighty.